And when they call you up,
can't see you because of the light, Matt. Assuming, oh, there you go. That's better. That's better. Everyone right to go? Okay, terrific. Thanks everyone for coming along here this morning for what is a very exciting announcement that I'll talk to in a moment. I'm joined by the Minister for Health, the Minister for Innovation, Medical Research and the Digital Economy, Margaret Gardner, the President and Vice-Chancellor of Monash University, and the team, Colin and the team from the Monash Institute of Pharmaceutical Sciences. So I'll give you a quick update on COVID, some further information on disaster relief support, and then go to the announcement. Then we'll hear from Minister Foley on further details in terms of the pandemic, and then to finish us off, Minister Pulford to talk about the announcement today, and then we're all happy to answer any questions. So firstly, in terms of the details on coronavirus, there are 51 active cases of coronavirus in Victoria. This morning we reported 0 local cases and 2 cases of returned travellers. Obviously very pleased to see these results, but you know, we just can't take our foot off the pedal in terms of doing everything we can do to get on top of this outbreak and to get through this pandemic, and particularly to get through this winter. So whilst we have a delayed rollout of the Commonwealth's vaccine program, the best thing that people can do, particularly this winter, is go and get tested the moment you have even the mildest of symptoms. It's the most important thing that people can do, and to go and get your vaccine as soon as you are eligible as well. In terms of disaster assistance, a couple of days ago I was out announcing funding for people without power for a prolonged period of time, so payments of $1,680 for residential properties that have been without power as at the 17th of June. We did say at the time that we'd look at what further support we can provide for businesses in a similar situation. So I'm very pleased to confirm that today the state and federal governments are providing assistance payments to businesses without power. So any business who, as at the 17th of June, have been without power since as a result of the storms, will be provided with $2,500 per week. So support for families in terms of their homes that are without power, and now we can confirm support for businesses that are without power because of the storm. So back to today's announcement. I'm really excited about this, and I was very excited to press the button and actually produce a mRNA vaccine this morning. Back in April, we announced a $50 million fund to kickstart mRNA research and a pathway to local manufacturing capability in Victoria and our nation. As part of that, today we're announcing $5 million that will support the Monash Institute of Pharmaceutical Sciences and Australia's first locally developed mRNA vaccine that will now proceed to phase 1 clinical trials. This is an incredibly important, incredibly exciting step that we are making in our nation. This will get us on a pathway to local manufacturing capability. As I've said a number of times, it would be better to be in this position 12 months ago. 12 months ago would have been the better time to develop local mRNA capability and ultimately local manufacturing. The next best time is right now. This will be particularly important because this vaccine and this virus will be with us for quite some time. We may well need yearly booster vaccines in the years ahead. And this technology, mRNA technology, is also critical for other life-saving treatments. So the clinical trials will start later in this year. We'll have the results of those in the first half of 2022. But the bottom line is we can never, ever be in a situation where in the face of a pandemic we do not have local capability in terms of developing vaccines. We do not ever want to be in a position where we are 100% reliant on global supply of vaccines, and that's why today is such a critical step forward. And to the team at Monash University, my thanks and gratitude for this important step. I might ask the Minister for Health to go through some details, further details in terms of COVID, and then I'll ask the Minister for Medical Research to go into some further details about these trials. Martin.
Thank you, Acting Premier. So, in terms of the current outbreak, I just wanted to bring Victorians up to date with some positive progress and some further updates. So I can inform us that the original City of Whittlesea outbreak, we've now cleared 97% of the contacts associated with that particular branch of the outbreak, and the same goes with the cluster from Port Melbourne, which is also at 97% rate of clearance. When it comes to the West Melbourne outbreak, that was the Delta outbreak. We're now at 98% of contacts having been cleared from that particular cluster. Our Care Maidstone, the aged care facility, we're at 88% clearance, and the Reservoir family of 4 and their associated primary close contacts and secondary contacts, we're well down the path of 23%, given that that was a more recent branch. So the important support and assistance that we continue to provide the South Bank complex and support that group of Victorians getting through their quarantining is well underway, and I want to thank that group for the extraordinary efforts they're putting in to keep all of us safe, and it's a big effort that we've asked, and we're committed to getting you through this particular journey. I think it's reasonable to expect, even though today was a 0 day, and we always look to that, that given the numbers of people who are coming up to their 13-day tests, that it's probable that we'll still see a few people turn positive in that quarantining environment, given the numbers that are still coming through. The key thing in that respect is, as those, should that happen, that those cases are in quarantine, have no exposure sites, and we've got our arms wrapped around them for support and get them through this particular journey. I want to also advise that there are 2 cases that are under investigation at the moment. These are return travellers who are no longer in quarantine and who produced conflicting results on different testing platforms over the past 24 hours. This is highly suggestive of historical infections, and an expert review panel will be convened later today to consider those. But our public health teams in both cases have taken serology work with these 2 members of our community, and that reinforces the notion that this points to historical infections before these people arrived back in Australia. There were some 19,502 tests done yesterday. That's past more than 7 million tests over the course of this pandemic in Victoria. And as the Acting Premier said, particularly as we face challenges with the vaccine rollout, particularly as we are in winter, the most important thing all of us can do is, even with the slightest of symptoms, please come forward and get tested as quickly as you can. With over 200 testing sites right around the state, this is the most important early warning system our public health teams, our GPs and others can have to make sure we stay ahead of this virus, particularly given that globally the Delta variant seems to be the dominant strain of the variants of concern out there. Yesterday we returned 12,242 vaccines through our state-run centres, bringing to almost 900,000 vaccines that we've delivered through those state-run clinics. Together with our partners in the GP and primary healthcare networks and the Commonwealth's delivery, we're now almost at 2 million vaccines here in Victoria. And can I use this as an opportunity to remind everyone who are due their second dose of Pfizer, given that we've had a huge response over the last few weeks for people coming forward from 40 and above to Pfizer. And if you're falling due this week, please come forward through the booking systems that we've had in place. If you've yet to book, call the coronavirus hotline or hop on to coronavirus.vic.gov.au and make sure you get that second booking. There is suitable supply there now for those second doses, and it's really important that you come forward and get that. If you've had, as so many have, the first dose of AstraZeneca, particularly for those people who were in the over 50s category, like myself, who have had the first vaccine, you still, upon the advice of the Commonwealth medical officials, to come forward and get that second dose. It is very important. Many of those start clicking in already. I'm due in a few weeks yet, but I am very confident that based on the medical advice, almost 1 million people are in this category, and we all need to get that second dose of AstraZeneca to get us through this, the challenges of this winter. Finally, I just need to reinforce that if people are coming into Victoria, particularly from interstate jurisdictions, they do need to attain that easily to get, doesn't take very long, online travel permit, just to give our public health officials the certainty they need to track people's movements as we see some challenges across other eastern seaboard states at the moment. So regardless of where you come from, if you are interstate or returning, please make sure you go to service.vic.gov.au to get that travel permit. I should also remind people that if you are coming from the local government areas in Sydney as follows: Woollahra, Waverley and the City of Sydney local government areas, at the moment you need an orange zone permit, that being pretty straightforward. Get yourself tested and isolate until you get a negative result. I'm pleased to see that our authorised office teams continue to meet all flights from Sydney at both the airport here in Melbourne and making sure that people have that up-to-date information, and for the smaller number of flights that come into Bendigo and Mildura, that authorised officers are also meeting those flights. These are, together with QR coding everywhere we go at every opportunity, maintaining social distancing and requirements to keep ourselves following the public health rules, and to get vaccinated when we can within the constraints of supply that we're all working under. These are the important principles that will get us through this pandemic. And I use this opportunity just to remind all Victorians that the public health rules are there for all of our collective well-being, and they need our strong support, a strong continued support. And on that note, I might hand over to Minister Pulford to talk about this exciting mRNA development.
Thanks so much, Martin, and good afternoon, everyone. Vaccines are our most straightforward path through this pandemic, and to get to the other side, we need a community that is confident to be vaccinated. We need adequate supply to meet demand, and of course we need to be supporting our science and research community to do what they do in terms of extraordinary discovery. Not that many weeks ago, we provided a $50 million funding in the state budget to establish mRNA vaccine manufacturing capability here in Victoria. In the weeks since then, we've established mRNA Victoria and appointed an expert scientific advisory group to support us in this work. And today I'm absolutely thrilled to announce that we are now in a position to take a Victorian innovation, a Victorian and Australia's first mRNA COVID vaccine candidate to a point of clinical trials. This is exceptionally exciting, and to Professor Colin Putin and his colleagues, I would like to thank them for their work and congratulate them on their work. We have set ourselves an ambitious timeframe to achieve this sovereign manufacturing capability, and this announcement today certainly demonstrates that we're absolutely on track to do that. So within months, manufacture to support clinical trials and results in the first half of next year, which I know everyone in the Australian community, everyone in the Victorian community will watch with great anticipation. The project will be supported by Victorian manufacturer IDT Australia. We have the scientific capability in Victoria to develop these vaccines. We don't yet have the manufacturing capability to support these vaccines, and that is what this grant is about, and that is what the next stage of this important work is about. So thank you, and I'm sure you all join me in wishing our scientists well on the delivery of the next steps of this first vaccine.
Very good. Thanks, Charla. Happy to answer any questions, and be aware I've got experts to my right so they can answer all of your technical questions.
Can we maybe just get them on the technical side of, can we maybe speak to the
absolutely.
experts
Colin?
first? Is that okay?
Can you just start with introducing who you are?
Take the mask off. Thank you.
Yeah, Professor Colin Poughton from Monash Institute of Pharmaceutical Sciences.
Can we just ask you about the first phase of the clinical trial? It'll begin within months, conclude by the second half of next year. When do you expect to be able to, I guess, pending the progress of the phase 1, fully form a vaccine, an mRNA vaccine here in Victoria?
Yeah, I'll try and answer that question. I didn't quite hear all of it, but I think I got the gist of it. So the clinical trial is a trial which we're doing jointly with the Doherty Institute. I should acknowledge my colleague here, Damien Purcell, from the Doherty. It's very much a joint project with our work here. And we're looking at a protein vaccine which has been developed by our Doherty colleagues in parallel with the mRNA vaccine. And there are some common features between the two vaccines that make it sensible to do them side by side. The trial is intended to start in October or November and will run until all the data is collected for a year, but we'll get an early indication of safety and the responses, the serum responses from individual patients fairly early on in the trial. Perhaps within the first 3 months, we'll have a pretty good idea of, because there are 2 doses of vaccine, it's a prime boost type strategy, so we'll know fairly within the first 3 months or so what the data is looking like.
Is there any way you can explain how this differs from current COVID vaccines that we have?
Yes, certainly there are differences. First of all, obviously in the climate of variants of concern, we're looking at a variant vaccine rather than the current vaccines, which are all based on the original Wuhan strain. There's also another significant difference which is worth highlighting, and that is that both the Doherty vaccine and our mRNA vaccine are aimed at presenting just the receptor binding domain of the spike protein to our immune system. And the advantage of that is that it should lead to neutralizing antibodies which bind directly to the receptor binding domain, which is what we're really trying to achieve with an antibody response. So we believe that vaccinating with just the receptor binding domain, which is only about 1/10 of the total mass of the coronavirus spike protein, we believe that that will lead to biasing the immune system, if you like, to producing a more neutralizing set of antibodies. And that's particularly important in relation to the variants, because The question everyone's asking now from a scientific perspective is, if you've been vaccinated with the Wuhan strain, can you now be boosted with a variant strain? And that's an issue which everyone's grappling with. We believe that the receptor binding domain approach is likely to be a better approach to those variants.
It's not that it's more powerful, but it's just more adaptable. Would that be a description? Or?
Well, the mRNA vaccines are very adaptable, just by virtue of the technology itself. But it's more also about whether or not you can correct, if you like, or improve on protection against variants using a booster. And we think that the RBD, the receptor binding domain booster, will be more effective.
We don't have the manufacturing capability of vaccines here in Victoria or even in Australia. So is the plan to be able to have manufacturing capability by then, or is it to essentially sell the IP to another country that can manufacture?
So what we're trying to do as part of this funding that's been announced today is to introduce the capability into Victorian manufacturing centres. Obviously, to make a product for human use, you do need to do it in a certified manufacturer. And after phase 1, going forward into efficacy, it needs to be a GMP quality product. So that needs a GMP certified facility. We do have those in Victoria, but they're not experienced at making mRNA vaccines at present. So during this period of making a clinical trials product for phase 1, we'll be skilling up those company to start getting into manufacturing so that they could manufacture other products and other COVID products going forward.
Thank you, Brendan. Can we switch to the Acting Premier, if you don't mind? Thank you for the...
Thank you.
Thanks, Colin. Mr Molino, where are we at with getting crowds to the footy in Melbourne?
Where we're at is where we always are on these important questions, whether it's crowds at the AFL, which we all want to see as quickly as possible back in Melbourne. It's always subject to public health advice. You know, we took a really great step by having a crowd at that magnificent game, Doggies versus the Cats in Geelong. We want to get crowds back in Melbourne as quickly as possible, but with all of our restrictions, with all of our settings, that's based on public health advice. So there's ongoing engagement between public health and the AFL and other elite sports about what our settings will be for crowds. But no announcements to make today, but just assuring the community that there's continual engagement. We want to get back to where we were just, a few weeks ago, but we'll do it in a careful and stepped way. We saw that first step in Geelong on Friday night. We'll see some further steps, but that will be based on public health advice.
You're expecting those further steps to come during this week?
I won't foreshadow the kinds of easing of restrictions, but as we have committed to do and as we have delivered, every week through this period of the outbreak, every week we've got to a position where we can provide further easing of restrictions for regional Victoria and Melbourne. That's my expectation. The expectation of my colleagues in public health is that later in the week we'll be able to announce further easing of restrictions for regional Victoria and Melbourne.
The public health
talked a lot about football in particular and elite sport, but what's being done in terms of the arts and getting people back into crowds at shows and venues?
Same thing applies, and I'm only talking about AFL because that's the question I'm asked. In terms of industry engagement, in terms of tourism operators, the Alpine Resorts is a key example over the last couple of weeks. Theatre, the arts, we want crowds back, but we want to do it, we must do it in a safe way. That's been our pathway through this pandemic, and I want to thank Victorians, all Victorians, for following the rules, doing the right thing. That means that public health can get in front of this outbreak and drive it into the ground. We are not there yet, but every week we are making progress, and that meant we could remove the regional metro division last week. It means that we'll be in a position later in the week to announce further easing of restrictions. And that will be all of those things, and all of those industries will benefit. We want to get back to crowds, theatre goers at sporting events all of the activities we love, we want to get back there as quickly as we can.
I'm sure the public health team have been considering some of the settings that are set to be eased, that I guess, you know, some of the reservations that they might have, some of the first things that might be eased. What is their thinking at the moment? You know, if all goes well, we have no mystery cases, all of the cases are linked, we still have 0 days. What are some of those early settings that could be eased?
Well, it's a similar question to the last one, Samaya. You know, we're in a position to receive public health advice and recommendations in terms of easing restrictions. That was just a few days ago. You know, today's Sunday. The previous set of easing of restrictions came into effect at midnight on Thursday. So it's all of the things that are taken into account. The number of cases, the type of cases, the primary close contacts, the exposure sites, all of that is taken into account in terms of what may be the next set of easing of restrictions.
But I guess the public health team doesn't wake up on a Tuesday morning or a Wednesday morning and say, yes, these are the restrictions that are set
Correct.
to be eased. They're obviously thinking about it from now. What are they thinking?
Well, it's not just a daily assessment, it is an hourly assessment of what is happening in Victoria, indeed what's happening right across our nation, but importantly what's happening in Victoria in terms of the work, the excellent work of our contact tracing team, the number of primary close contacts and exposure sites. As I think Professor Sutton indicated yesterday at the press conference yesterday, we have an expectation that we will be in a position to provide further easing of restrictions. I don't know if the Minister for Health wants to add anything more, but happy for the Minister to answer.
This is something that Minister Foley could potentially answer as well. Professor Sutton and the public health team obviously think that they could ease restrictions. And I guess my question is, what kind of restrictions are they thinking that could be potentially eased come Thursday?
Oh, well, you look at our track record over the last couple of weeks. We've had a difference in settings between regional Victoria and metropolitan Melbourne for a clear reason. We want to make sure that the virus, that we protect regional Victoria from the virus, and that's the reason that we need to have some slightly tighter restrictions in Melbourne. But what we've been able to do over previous weeks is bring regional Victoria and metropolitan Melbourne closer together. At the same time, provide some further easings in both settings.
Just on the point, hour proposition, why are we sticking to that Thursday weekly timetable of the next stage of restrictions easing?
It's appropriate that whenever we provide for an easing of restrictions, we want to see public health want to see the impact of that. You know, you can't just make daily easings of restrictions. You need to have settings in place, and let's see how we go for a period of time. The advice from public health is that we need that 7-day period to make sure that the settings we have put in place are working, and there's not a reason to make any make restrictions tougher again.
Well, just on the point of protecting regional Victoria, that requirement for Melburnians to get tested before they go to the ski fields, given the low numbers that we've had over the past days, is that something you envision lifting, or is that something that will remain for the entire ski season?
Look, I don't want to foreshadow what we may ease later in the week. I've got an expectation and a level of confidence that we will be able to do that, and that's shared by public health. But in terms of what may be eased, that is still subject to this constant analysis in terms of how we're getting in front of this outbreak. There's a very specific reason why the snowfields were highlighted, and I think a common sense approach that if you want to go to the alpine resorts, if you want to go to the snow, just get tested, show that you've got the negative result, and then you can head up the mountain. I think that's been a common sense approach to what is a much higher risk setting, and Professor Sutton went to that as to why it's such a high risk setting in some detail.
With the easing of restrictions, history has shown us that regional Victoria takes a step out of restrictions and then Melbourne follow suit without promising anything. Is that what we're sort of potentially expecting by the end of the week?
Yes, mate. That's been our approach over the last few weeks. We've been able to be a step ahead in regional Victoria in terms of whether that's density quotients, visitors at home, other community sport and other settings. So that's certainly been our approach. But again, it'd be absolutely wrong to foreshadow what may be part of the next set of easing of restrictions because we're not there yet. Today is a good day to have a zero, but this outbreak is not yet driven right into the ground, and that's why we need to continue to have COVID-safe, common-sense settings to make sure that this doesn't get out of control.
New South Wales are still only making masks mandatory in a couple of LGAs. I know you probably don't like to pass commentary on what's happening in another state, but does it surprise you that we're all still wearing masks with no cases today, and not everyone in Sydney or in New South Wales are wearing masks with, you know, a tally of 9?
Yeah, look, this is the settings that every jurisdiction have is based on their public health advice and on the circumstances of their particular outbreak. And as I've said a number of times, there have been other outbreaks here in Victoria where we haven't gone into a period of lockdowns. Black Rock and other events where through contact tracing we've been able to get on top of it. But every outbreak is different. We had, with this outbreak, generations of transmission and clear public health advice that we needed to take the steps that we did take. In terms of what New South Wales or any other jurisdiction does, that's based on their public health advice and the circumstances of their outbreak.
Minister, just on the production of the mRNA vaccines here, is it disappointing that the federal government aren't leading the way on that? Recent estimates say it's going to take them 4 years to get a production facility up and running. Is Victoria going out on their own here?
Oh, well, Victoria's taking a leadership position on this, and it's the right thing to do. You know, we don't ever want to be in a position in any future pandemic where we don't have the capability in our own nation to develop technology and vaccines to combat that. We don't ever want to be in a situation where we are at risk of global supply issues. That's why this technology, this capability, both in terms of a research and manufacturing sense, is just so important. So we took a leadership position when we announced the $50 million fund. We are working very closely with the Doherty Institute, with Monash University, with other research institutes to make sure that we have this capability as quickly as possible. It would be ideal if we had national leadership on this. It would be ideal if we had this capability 12 months ago. We do not. But it doesn't mean that this is any less an exciting step that we are announcing today. To go to be the first Australian phase 1 clinical trial, that is the most important step to local manufacturing, and we need it as a nation. And Victoria is the leading, is the centre of medical research in our nation, and it's appropriate that it's happening right here.
And are there any plans to have the manufacturing capability as well? I know at the time you said that you'd be asking the federal government for some funding for these mRNA vaccines. Have you heard back from them yet?
No, we haven't, Samaya, but that remains the case, that this needs to be a partnership between the state government, universities, research institutes, manufacturers and the Commonwealth. We've got the $50 million fund. $5 million of that is used for today's announcement. We've got our breakthrough fund, our $2 billion breakthrough fund to support innovation. But we continue in a genuine way wanting to engage with all partners, because that's the only way that we can make this a reality.
Not too long ago, the AMA were calling for phase 1A of the vaccine to be completed in its rollout by the end of June. Is that realistic? Is that going to happen?
I'll get Minister Foley to talk about where we're up to with 1A and 1B, but just to reiterate the point that we do not have the supply of the vaccine from the Commonwealth to meet the demand. We've got a National Cabinet meeting tomorrow, and I'll hear what the Prime Minister has got to say. The last National Cabinet, the Prime Minister made it very clear to every single state and territory Don't worry about second doses. We have got all that you need. You just get out and deliver your first doses. Well, the reality of that is wrong. We do not have the supply of second doses from the Commonwealth to match the demand for first doses. We got a very high-level schedule of delivery overnight from the Commonwealth, and it continues to show that there will be weeks in July where we will drop to 85,000 vaccines. So we continue to see an environment where the Commonwealth is not matching supply with demand. It is fair to say the Commonwealth's vaccine rollout is an absolute shambles.
When do you expect the supply into Victoria, according to that manifest you saw last night, to increase again?
Look, I'll obviously get more details, hopefully, at National Cabinet tomorrow. But this very high-level schedule shows some increase, but there are weeks in July where we drop to 85,000. So we are well short of what we need. They're talking about later in the year, in the last quarter of 2021, where they say that we'll expect to see an increase in supply. But what that means for Victorians, in the depths of a cold winter in Victoria, we do not have the supply of vaccine that we need to meet demand.
There's a global supply issue, obviously, and that additional 150,000 doses of the Pfizer and the AstraZeneca as well. My understanding was, Victoria could catch up with its second doses, so it could have the first and the second dose back in sync. Is that not the case?
Well, all I can tell you, Samaya, is that the schedule that was provided overnight still has weeks in July where we drop to 85,000. So we are not matching supply with demand because of the fact that we've had not enough vaccine supplied by the Commonwealth. Now we'll see if there's any further detail at National Cabinet tomorrow. But that's what this schedule still shows.
So it went from 71,000 to 105,000 for 3 weeks, and that additional 35,000 per week was for Victoria to be able to catch up with its second dose. Was that not the case?
I'll get Minister to go into some further detail. But what we have seen, it's not, demand's not static. We've increased eligibility to 40 to 49-year-olds. We've had a hit on confidence on AstraZeneca with the National Health Advice and the Commonwealth's decision. So we're seeing, a big spike in demand for Pfizer, and that supply not adequately being met by the Commonwealth. But I'll ask the Minister to go into some detail.
So, Mayor, if I understood the question, so those people who are due their second dose of Pfizer over the coming weeks ahead have every confidence that that will be delivered. What we've nuanced over the last few weeks is to make sure that if you've had your first Pfizer, and remembering the rules keep changing, that was the group in the 40 to 49-year-old age group, and the ATAGI advice is you can get that between 17 days and 3 weeks and 6 weeks. That will be delivered, and that will be delivered on the basis of a couple of weeks ago's extra Pfizer that Victoria got in response to its demand. As of the results of the ATAGI decision adopted by the Commonwealth last week, we now have another group of the 50 to 59-year-olds who have yet to receive any vaccine to accommodate them in the Pfizer dose. And then we have another group of 1 million people who are in the 50 to 59-year-old group who have had one AstraZeneca shot, who are due over the course of the next weeks and months their second AstraZeneca shot. In partnership with the GPs, we think we've got enough for all of those groups. What the Acting Premier rightly points out, and what all the states point to, is over and above that, there are still many hundreds of thousands, if not millions of Victorians who want to come forward and get vaccinated. And the inescapable reality is that the state's issue is supply. And whilst we will make sure that we nuance to make sure people get those allocations of Pfizer and AstraZeneca as they fall due, that comes at the expense of other Victorians who want to be vaccinated, with GPs who are ready to vaccinate them, with a state clinic system that is capable of vaccinating. The one thing we are missing is supply.
The federal government was obviously a bit late to sign on with Pfizer deals. Is there anything that can practically or even really be done at this stage in terms of increasing the supply here in Australia?
Well, look, to paraphrase the acting Premier, it would have been great if these supply issues had been dealt with 12 months ago. They weren't, and now what we've got to do is make the best of the situation we're in. We will continue to work cooperatively with the Commonwealth. All the states have to. We've got no choice. But the issue for us is we are constrained by supply when we have demand that outstrips that supply. We want to work through that in the best way we can. And we want to work cooperatively with the Commonwealth to make sure that as Moderna comes on, as extra Pfizer comes on, that we get that in as soon as we possibly can, because this is a race. And what we want to make sure is that every eligible Australian is vaccinated this year.
Just on Queensland and New South Wales, do you have any plans to potentially increase the set of restrictions or make Queensland an orange zone?
So all of our assessments are based on the really good cooperative information sharing that works across jurisdictions. Every day that sharing happens. It's happening right now at a scheduled AHPPC meeting, and based on that and based on the rigorous assessment by all of our public health teams, if there's anything more to say about that, we'll have more to say about that when we get the advice. But at the moment, it's just those couple of local government areas in Sydney where it's an orange permit application. So if you've been in those local government areas at that period of time, you need to get a test and isolate until such time as you get a negative test. And if you've been in other jurisdictions more broadly, please get onto the Services Vic app. It literally only takes a minute or two and get the permit in place. So it's just to make sure that this electronic record keeping can be shared in the most timely way if we need to.
Do you expect any of those extra local government areas to be added today? I think it's 7 now in Sydney that have to wear masks indoors.
Well, as I indicated, the public health teams from around the jurisdictions are meeting right now, and that information will be shared. And if there's more to say, I'm sure we'll have, through the normal public health releases later in the day or through further announcements, have more to say. But we don't have anything to say on that just yet.
Just one quick question on vaccines. If I'm after a first dose Pfizer booking, how soon, or what's the lead time on that?
Well, we'd ask to hop online, look at the options available for you. Some areas are in greater demand than others for all sorts of areas, so if you're prepared to be a little bit flexible as to where you might go and when, that's capable of being landed. But it varies, but there is supply there now that we've nuanced with the assistance of the Commonwealth over the last few weeks to meet that really big, strong demand that we've had over the last 3 or 4 weeks. As the acting Premier's pointed out, we have still got millions and millions of doses to get into the arms of Victorians over the course of 2020, and we can't do that with any certainty given the predicted levels of reduction that we're going to see over the next few months. We're in, I'd like to think, productive discussions with the Commonwealth to see how that can be addressed. As the acting Premier has indicated, we hope that this can be clarified at National Cabinet, but it all gets back to supply from all of the states' point of views.
The former head of the Victorian AMA has been in The Age this morning calling for a Royal Commission into the Victorian Government handling of COVID last year. What do you make of it?
Well, my focus is on what we need to do today, tomorrow, next month and for the rest of this year to deal with this pandemic, support our community, ease restrictions. You know, that is my focus 100%. Other people may have other views about what should happen. My focus, the government's focus, is on supporting communities and driving this outbreak to the ground and then getting our vaccine rolled out as quickly as humanly possible.
Okay, just on another matter, it's got nothing to do with COVID, but the expansion of high productivity freight vehicle network, that's happening now. Does this mean there'll be more trucks on inner city residential roads?
No, this is about, as I understand it, identifying efficient routes in terms of getting our freight moved around the city and the state more effectively, more efficiently, as well as a focus on reducing emissions. But I'm happy to come back to you.
With the school holidays coming up at the end of this week, there's a lot of families that have holidays booked interstate, in particular Queensland, whose border remains closed to Melburnians. What would be your advice for families that have interstate travel planned? Is there something you'd be discussing with your interstate counterparts about lifting those restrictions?
Oh, the settings that other states have in terms of their approach for Victorians travelling to Queensland or any other part of our nation is settings for them. So I won't say what settings they should have, and I wouldn't expect that they would be indicating to us what settings we have in Victoria to deal with an outbreak in the rest of our nation. My hope, and my expectation and my experience are that states and territories reflect the situation on the ground, and where that situation improves, as it has been in Victoria for the last number of weeks in terms of getting in front of this outbreak and easing of restrictions. You've seen a corresponding easing of restrictions of other jurisdictions, firstly to regional Victoria, and my expectation will be, as we continue to get on top of this outbreak, that it will be reflected in terms of their settings of Melburnians travelling interstate.
Announced yesterday they were getting 200 generators brought in for those affected people. We'd heard this morning no one had received them yet. Is that rollout happening? What's happening there?
Yeah, so there's a rollout of 200 generators. My understanding are that they are being progressively rolled out. I'm happy to come back to you in terms of the detail. It's about all the supports that we can put in place. As I said a couple of days ago, there are some 1,400 people before the ADF, so around more than 1,000, whether it's 500 volunteers across our emergency services, particularly the SES and the CFA, career staff from Forest Fire Management and other parts of DELP, VicPol, more than 1,000 people there, plus just under 400 AusNet crews getting people connected to power as quickly as possible. Then we announced the support for people that will be without power for quite a period of time. There will still be people without power into July. So we announced the $1,680 prolonged outage payment support, and today we're announcing the business support. So we're looking at everything that we can do, including the provision of generators, including an additional 120 ADF personnel to support the more than 1,400 people already working on the ground. Great. Thanks, everyone.
Pleasure. Oh, you know.